We wanted to take some time this mid-morning to answer your questions about COVID-19 and the outbreak.
Joining us now is Dr. Tim Sielaff, Allina's Chief Medical Officer. Doctor, thanks for answering all these viewer questions for us.
My pleasure.
Let's start with the issue of tests, because this is obviously, it's a political issue, it's a medical issue, it's a question of, you know, right now we don't have enough tests to deal with what the demand is. And so do you think we really have a full handle on how widespread this is?
We definitely have a gap in the information, the understanding of this epidemic, this pandemic in the United States because of a lack of testing and because of the timing when testing is becoming available. We need the information. We need to understand the transmissibility. We need to understand where there are outbreaks, how we can mitigate the spread of those outbreaks. So we really need testing. Testing is going to be really vital information for us.
I think a lot of people are wanting to know, what is it like to have the coronavirus? I mean, most of the cases are mild. What can you tell us a little bit about?
What does mild mean?
What does mild mean?
Right. So, you know, mild will have a spectrum like anything, but I would say that it is more like a case of the flu, where one has fevers and has a cough. If that progresses and turns into having shortness of breath, very high fevers, feeling even more unwell, then those are the signs that one should seek attention from the medical system.
Let's ask Adam's question. Can you speak to the risk in infants under 1? A lot of info on children out there, but not much regarding the very young. Do we know?
Right. The information that's out there on children appears to be that they are at a lower likelihood of getting ill. In infants, individuals under 1, there's even less information, and so it's really hard to speak authoritatively about that. So it would make perfect sense to follow the same general guidelines, and it may be the case that an infant might not get ill, but could still transmit the disease.
Charlie has a good question about allergies. How do you tell the difference between if you have COVID-19 or if you have a cold and allergies?
Right. It turns to that notion of having high fevers and a dry cough, occasionally a productive cough. So the fever and the high fever tends to be one of the key differentiators between a cold and certainly allergies.
Warning sign number 1, the fever. Marcia asks, if we are over 55 and healthy, should we stay home as much as possible, or can we go about our lives?
Sure. I think the issue is your own personal health and then your potential for asymptomatically infecting other individuals. So what I would say is that there is a sort of a community imperative that we're undertaking right now, and although you don't necessarily need to sequester yourself at home, it's the case that being really careful about your activities and being in areas where there are lots of folks in a high density would be better avoided. And for sure, if you have any illness, any sign of feeling unwell, then absolutely one should be very cautious about venturing out.
Well, Jean wants to know if a person is returning from a vacation, either international, domestic, or a cruise, is it necessary to quarantine without symptoms or known exposure? Because we know that you can be carrying this virus and not show symptoms.
Absolutely. If you're returning from a level 2 or 3 country or a cruise, especially a cruise in a high-risk area, then that notion of quarantining for a period of 2 weeks is really the best practice.
You should do it.
You should do it, and our organization is having that as a policy for our employees, because our employees are the folks that deliver care, and we really think that it's vital to have a safe and healthy provider population, the folks that are taking care of individuals and their families.
Jeff wants to know if a flu shot might lessen the effect of how coronavirus would show, not coronavirus, but COVID-19, the disease, how that would show in people. Do
right.
you know?
The flu shot by itself won't have any effect, but it will lessen your chances of getting the flu, and that is absolutely valuable just by itself.
Sure.
Other vaccines, like for pneumococcal pneumonia in older people, would be important as well, so that if one were to get an infection and you're an older individual, your likelihood of getting a secondary infection that might worsen your COVID infection would be limited.
Why the 14-day quarantine? Why that length of time?
It appears that patients are shedding virus for about 10 days, give or take, during their illness. And so it's to be outside of that virus shedding, that infectiveness
So you
time
kinda,
frame.
as you get rid of it. Then
Absolutely.
Very good.
All right, thank you, doctor, so
Doctor,
much.
appreciate it.